Hello everyone, and welcome back to the Medical News Update. Today, we'll explore some interesting research findings, including how the timing of exercise might impact blood sugar levels in people with type 2 diabetes, how having cinnamon affects blood glucose level in people with prediabetes, how eating avocados might affect diabetes risk, the effect of empagliflozin in patients with heart attack, and the protective effects of a new monoclonal antibody against malaria in children. The Look Ahead trial explored how the timing of exercise might affect blood sugar control in people with type 2 diabetes. This study involved 2,416 participants, mostly women, with an average age of 59, and it followed their health over 4 years. Researchers discovered that exercising in the afternoon led to the most significant reduction in HbA1c levels at the 1-year marks, suggesting this might be the best time for managing blood sugar levels. However, the effect did not sustain through to the 4-year mark, indicating that the benefits may diminish over time. While these results are promising, the study's observational nature means more rigorous trials are needed to confirm these findings and possibly integrate them into diabetes management strategies. Our next study investigated the effects of cinnamon on glycemic response in adults with prediabetes over 4 weeks, using a randomized controlled crossover design. The cinnamon intervention was found to significantly reduce after meals blood sugar levels compared to the control group. This suggests that daily cinnamon consumption might help manage or improve blood glucose control in individuals with prediabetes. While promising, the study's short duration and small sample size call for longer-term studies to fully understand cinnamon's potential benefits and mechanisms in glucose control. Such dietary interventions could be a low-cost additional therapy for managing prediabetes. Moving on to the study on avocados. A study from the Journal of the Academy of Nutrition and Dietetics assessed whether eating avocados could influence diabetes risk among Mexican adults. This cross-sectional study used data from the Mexican National Health and Nutrition Surveys from 2012, 2016, and 2018. The findings suggest that regular avocado consumption was associated with a lower rate of diabetes. This beneficial effect might be due to the healthy fats and fibers in avocados, which are known to have positive effects on glucose metabolism. Despite these encouraging results, the cross-sectional nature of the study means it can't prove that avocados reduce diabetes risk, only that there's an association. More research is needed to understand the potential benefits fully. Moving on to our next trial. A randomized, placebo-controlled trial evaluated the effects of empagliflozin on patients at risk of heart failure following an acute myocardial infarction. The study included 6,522 patients, with a median follow-up of 17.9 months. The primary endpoint was a composite of hospitalization for heart failure or death from any cause. The results showed no significant difference between empagliflozin and placebo groups in reducing the risk of these outcomes. A first hospitalization for heart failure occurred in 3.6% of the empagliflozin group compared to 4.7% in the placebo group, showing some potential benefits. Although empagliflozin did not significantly reduce the primary composite endpoint, the reduction in hospitalizations for heart failure is consistent with previous findings about SGLT2 inhibitors. These results suggest further investigations into SGLT2 inhibitors for specific post-myocardial infarction conditions could be valuable. Moving on to malaria, a trial in Mali evaluated a monoclonal antibody, LNLS, in preventing malaria in children aged 6 to 10 years over a 6-month period. This phase 2 trial involved 225 children and compared 2 different doses of the antibody to a placebo. The trial found impressive results, with the antibody significantly reducing the risk of malaria infection by up to 70% compared to the placebo. It also decreased the incidence of clinical malaria, showcasing an efficacy of up to 77% in higher doses. This study highlights the potential of monoclonal antibodies as a new tool in malaria prevention. However, long-term studies and evaluations on how this treatment can be integrated into current prevention strategies are necessary. Thank you for joining today's episode of the Medical News Update. For more insights into the latest health research, make sure to subscribe to our podcast. Until next time, goodbye.